Mm. Welcome. I'm Dr. Streicher, and I am the medical director of the Northwestern Medicine Center for Sexual Medicine and Menopause. And, as a gynecologist, I'm well aware that nobody gets all excited about their annual exam. No one gets excited about having a pap test, but women do it anyway. It's kind of like getting a cavity filled. But for a woman who has a past history of personal or medical trauma, a visit to the gynecologist is not just unpleasant. It actually may be impossible, and that's where trauma-informed care comes in. So I'm so pleased this evening to be joined by my colleague and friend, Dr. Traci Kurtzer. When Dr. Kurtzer first came to the Center for Sexual Medicine and Menopause, I knew she was an outstanding clinician with expertise in menopause, expertise in sexual medicine, expertise in vulvar care. But at the time when she first joined us, I was not aware that she was also an expert in trauma-informed care. And patients are not the only ones who've benefited from this expertise. All of the clinicians, myself included, continue to learn so much from Dr. Kurtzer. So I'd like to welcome Dr. Kurtzer, bring her on up. And hi.
Hello.
Before we get started, I just want to mention that in addition to being an attending physician in the Center for Sexual Medicine and Menopause, Dr. Kurtzer is the medical director of trauma-informed care and education in the Department of Obstetrics and Gynecology at Northwestern University Feinberg School of Medicine, and is a member of the Healthcare Committee of the Cook County Human Trafficking Task Force and the Trauma-Informed Hospital Collaborative. So lots of expertise, lots to talk about. So I'm so glad you're here. We can have this conversation. I do want to start by mentioning that if anybody has any questions, they should put them in the comments stream on Facebook. We're going to try and keep this private. We will not be using names. And also, just so everybody out there knows, this will get edited later. So if there's something that comes up or you're uncomfortable with, just direct message either one of us, and we can make sure that it does not end up in the final thing that will be on Facebook and YouTube. So let's start by Dr. Kurtzer, just tell us, what is trauma? I mean, trauma means a lot of things to different people. So when we're talking about trauma, tell me specifically what we're talking about.
Right. First of all, thank you so much for having me here and allowing me to talk about this subject that's so near and dear to my heart, and I think really important for all of us to be aware of, both medical providers, but also all of us are patients as well. And so that's such a first good question, because definitions are important. And I do want to clarify that even when we talk about trauma-informed care, even sometimes healthcare workers think that we're talking about the kind of care, taking care of physical injuries that might happen due to accidents or acts of violence. But when we're referring to trauma-informed care here, the trauma we're talking about is the stress that happens from an event or series of events that one's experienced in their lifetime. You mentioned some in your opening. But that stress that was perceived to be emotionally or physically harmful or even life-threatening, and that has lasting adverse effects on the person's functioning, whether it's their physical functioning or psychosocial well-being.
Yeah, and that's such an important distinction because you're right. Especially in medicine, when we think of trauma, we think of a car accident or a gunshot wound or something like that. And that's really not what we're talking about here. So could you give some very specific examples of the kind of trauma that your patients have experienced?
Sure. And trauma, those physical things can be part of somebody's trauma experience overall. So that is, having medical events that are serious like that and recovery can certainly contribute to somebody's overall trauma. But specifically, what we work with the most here, and what I do is seeing patients that have experienced sexual assault or a history of sexual abuse. I'm referred patients from the emergency room for their follow-up care and taking the required testing, but also providing a lot of social and psychosocial support for them as well.
Mm-hmm.
We see patients that have certainly had medical trauma, so past experiences where their gynecology visit was very difficult, either because it just happened to be difficult or because they have some conditions like vulvodynia or vaginismus that can actually cause a lot of pain during exams, and unfortunately it kind of continued through without them being able to address that.
I do have a question about that because a lot of times it's the first experience, worst experience kind of thing. So how often when we talk about gynecologic trauma is it that someone had that first horrible experience, even maybe as a young woman or as a teenager, as opposed to something that happened after they've been to the gynecologist many times?
Yeah, I think very, very often, probably about 50% of the time, it was that first, just a bad experience. And they actually, when they're coached and things are explained to them, they actually do just fine with an exam, a trauma-informed exam. But there certainly are individuals that the first time they are really being challenged physically in that area, it could be their first gynae visit, and that may be incredibly painful for them, again, if they have certain medical conditions that need to be evaluated for.
But I think also sometimes, I've always heard about this from patients, the young woman particularly, the young teen, who is subjected to an exam that she didn't really need even, and was kind of forced to have an exam. And I think that could be really traumatic as well.
I'm sorry, could you repeat the question?
I might change my microphone here. I don't know if this is me or you, but just how the very first traumatic exam as a young girl can sometimes be a huge problem.
Right, yeah, absolutely. And we definitely see many patients that's the experience. We're referred patients from our colleagues from different social service organizations in the city that work with patients who are dealing with sexual trauma or domestic violence, who have dealt with some really serious physical or sexual assaults in their past as well.
So let me ask you this. I've changed mics. I'm hoping that's a little bit better. Maybe not.
Sounds good.
How often does this happen? Because, most gynecologists, obviously, we're not trauma informed, and we're going to get to that a little bit later. But I don't think that most of us, even in this world, have a sense of how common it is. So how common is it?
To have a painful gynecology exam?
to really have not a painful gynecologic exam, but to require a trauma-informed exam. How often do women have the kinds of trauma that you're talking about, whether it's medical, personal, psychological, how many women would benefit from trauma-informed care, I guess is what I'm saying.
Well, I'm very biased. I think that there's so many different experiences and sources of trauma. Of course, they can be varied as far as their degree of harm and other factors, but my feeling is that really universally all women should be provided trauma-informed care because it goes beyond just the exam. It's how we're interacting with the patients in a collaborative manner and very patient-centered care. So it's a bigger picture to it. So I would say, and many people come in and don't necessarily report or come in having had a history of trauma, and yet they might be quiet, and we could potentially cause trauma from our exam and not realize it if we're not sensitive to how to perform a trauma-informed visit overall. So I don't know the actual numbers, and of course we see mostly patients with trauma here. When I was in my gynecology practice, I would say, it's probably a good 20 to 30% of women that had a history of having very difficult exams in the past.
Yeah. No, I think you're absolutely correct, and that's such an important point, because for some women, quite frankly, nobody likes the gynecologist, but for some people, it is no big deal. They kind of get up in the stirrups and go, oh, whatever, and then they're just kind of, and with it. And as gynecologists, whether we know that someone has had a history of trauma or not, it is so important. And as we teach medical students and residents to be very much aware that it is very difficult for some women, and even things as simple as things that we do automatically, like explain every single thing that we do, and to get permission, and to use ears so that people can participate, and all of that. We know that that's not necessarily going on in other offices.
And I would add there that many women who've never reported or experienced having difficulty with their routine gynecologic checks, still, after going, through a visit in our office, say that was one of the best exams I've ever had, because just that interaction, that communication. I think when you think about a typical, gyne visit, that's very, very quick, and there's a lot of, discussion going on during the exam. But I think when we're doing the exam, we have to kind of focus on the exam and be talking to our patients and getting permission, as you said.
Constantly. And I think, and I'm going to brag a little bit about us for a second, because at Northwestern, which obviously provides great care all over the place, but our Center for Sexual Medicine and Menopause, our patient comments are just off the charts. But to your point, is that our patients are saying, oh my God, I've never had a gynecologic exam, that everyone was so kind, that they were so gentle, that they took time, that they explained. And I honestly think that it's that reinforcement that we get back from the patients that continues to remind us how important all of this is. So the next question I have for you, and there probably is no way of knowing, there aren't any statistics, but do you have a sense of, when you look at women who have had a past history of trauma and that it is very difficult, how many of them avoid the gynecologist altogether? They just don't access the healthcare system, versus just, grit their teeth and kind of deal with it? Do you have any sense of that?
I think it's incredibly common, more common than we realize. And of course, those are statistics hard to acquire, because it would mean, surveying everybody and saying who is not going to the gynecologist and why, which just, there is no data out there like that. But I will say, so many women come in because they're having an acute problem, quite honestly. And so they have to come in, and, they will report, I've been avoiding coming in. I tried, to deal with this on my own as much as possible, because I absolutely hate going to the gynecologist. It's always so painful, or it reminds me of, something that makes me feel really bad and get me into a trauma state. So I think it's probably much more common than we realize.
I absolutely agree. For anyone who has just joined us, I am talking with Dr. Traci Kurtzer, who is the Medical Director of Trauma-Informed Care and Education at Northwestern, and an attending physician in the Northwestern Medicine Center for Sexual Medicine and Menopause. Okay, so now that we've talked a little bit about who would benefit from trauma-informed care, can you specifically talk about what is trauma-informed care? How is it? I mean, you talked a little bit about, that we explain things a little bit more and all that kind of stuff. But what I'd really like to do is kind of, from the moment someone accesses the system, how does the trauma-informed visit differ from the typical gynecologic visit?
Right. Yeah. So it's the primary goals, I would say, are to provide a safe and collaborative relationship. So safety is key. That a lot of that comes through the visit and the exam, the physical pieces. The collaborative has a lot to do with the discussion and care plan that's developed. And a super critical piece is just not to cause secondary trauma. I can't stress that enough. So we want to not add to somebody's trauma.
But how do you know? How do you know? I mean, I'm a gynecologist. I think I do a good job. How do I know what things are going to happen during the exam that I know it's not going well?
Right, right. Well, there definitely, I mean, in severe cases, there can be actual signs of trauma reaction. You may have patients that are, losing eye contact with you, or even disassociating, where they're kind of staring beyond or past you. They're in a completely different state because you have actually traumatized them to the degree that they have to remove themselves from that situation. It can be, patients that during the exam are wincing or shaking their head side to side, or are kind of physically withdrawing to your touch. And just, even in a discussion standpoint, somebody that is perhaps reacting in ways that you would think don't make sense to you, that seem a little inappropriate, that often can, things that are triggering you. If you find yourself getting triggered or upset, a lot of times that's because you're picking up on the vibes of your patient that's been triggered or upset by something that you might have accidentally said.
Okay, so what advice do you have if a woman is having an exam from someone that is not trauma informed and is just getting into that state of this is not okay, this is not going well?
Mm-hmm.
What should she do? How should she advocate for herself?
Oh, yeah. I think communication is so important. And I do hear this from a lot of patients with those earlier bad experiences where they just felt like they couldn't say anything or speak up, that it was, that they were in pain or, feeling harmed in some way, and yet they just didn't feel that they could talk about it. Definitely, I encourage patients to be advocates for themselves and informing medical staff up front if there are certain things that they know are going to make the exam harder for them. If there's things that we can do to add to their comfort level, definitely say that up front. If something's going on that's not going well in the interview process or the exam, speak up about it. The whole point of the visit is about you. It's about taking care of you. And if somebody becomes offended by that, a staff member or a doctor, because you're doing that, then they're not trauma informed, and you need to find another doctor.
We're
Because
going to get to that about the finding somebody, yeah. But okay, but specifically for women who are listening and saying, okay, it's easy enough for you to say, speak up, advocate for myself, but give a script specifically. What are the words? What can a woman say? And it's not that the doctor is doing anything wrong.
Right.
It's that this woman is just feeling vulnerable and re-traumatized. Does she just simply say, I need you to stop? Or are there other words that
Yeah.
she can use?
I need a moment. This is painful. I need you to stop, or I need a moment to regroup for a second, or, this is not going well. Can we talk about, what needs to change so that I can be more comfortable?
Yeah, yeah. So, I mean, this is all well and good, of course, when someone is being examined by you, or I hope me. But, what about, well, let's just back up a little bit and say, how does a woman find someone? Because obviously, if someone is in the Chicago area, then they can come and see you. And of course, everybody always wants to know how to do that. So, if in fact they do want to make an appointment with the trauma-informed physician, then they go to sexmedmenopause.nm.org. And fortunately, we have actual human beings that talk to people and make appointments and all of that. And it is very, very important to specifically say, we have wonderful doctors, we have a lot of wonderful clinicians, but you are our trauma-informed, experts. So if someone really feels like they need that expertise, they should absolutely say, I'm coming in for such and such a reason, and I would like to be seen by Dr. Kurtzer because I want a trauma-informed visit. So that's easy if you're in the Chicagoland area. But what does somebody do if they are not in the Chicago area?
Yeah. Well, unfortunately, that's the bad news, because there's really no certification process. So there's really not a centralized listing. There are a few websites out there, but typically they're geared more towards mental health care professionals rather than medical professionals.
Yeah.
So it does require a bit more work from us as patients to find those medical practitioners. When you set up appointment, it can certainly be something that's asked by the office staff. And if the person who's answering the phone call says, what are you talking about? That's probably not a good sign.
Although, in fairness, sometimes the person answering the phone, they might have started yesterday and they don't know.
That's true.
I always tell people, if you're on the phone with someone who really just doesn't seem to have a clue, ask to speak to the office manager, ask to speak to, an RN, someone who's got a little bit more clinical experience, because we have great front desk staff. We are very lucky, and the people answering the phones are very good, but not everyone's. So before you just hang up and say, and run for the hills, sometimes it helps to ask for someone who might have a little bit more familiarity, especially if you live someplace that you don't have a lot of choice.
Right.
Not everybody's in a big city that they can find someone who's going to be helpful.
I think also, other healthcare professionals, I get a number of referrals from our primary care colleagues that have heard about, our work here. And so your primary care physician or other specialist may be aware of trauma-informed care gynecologists in the area.
Yeah.
But I think, unfortunately, sometimes there's a little bit of trial and error with finding that, right person. And it very specialty dependent as well. It can be difficult to sometimes find a trauma-informed care gynecologist because it's not so easy. I think it's not easy on the provider side. It's not really practical often for an office to provide that type of care in a typical, busy gyne office. So.
Yeah. I think one of the things is a lot of women are not aware that when they go to see a gynecologist for their annual exam, there's literally 15 minutes, for every single patient. And while that may be enough for someone who's just, dashing in to get a birth control refill and doesn't have a lot of issues, it is not even close to being enough for someone who requires the kind of expertise and care that you're talking about, which is also nice at the center that we are able to take more time with our patients. I mean, it's not unusual, I know, for you, when you have someone who really needs a lot of expertise and a lot of TLC to spend 30, 40, 45 minutes with someone, which is not at all unusual. The other thing also is that I've also had the sense from you that, you're better than anyone at being able to talk someone through an exam and make them feel comfortable and make them feel safe, which is the number one thing. But did you ever have someone who absolutely requires a gynecologic exam or procedure that no matter what you do, you can't make them feel safe? Do you ever even just use, drugs or anesthesia or anything like that to keep them?
Absolutely. That's an informed consent process with the patient, and that can be another source of fear or trauma for them. But sometimes that is a requirement, is, making sure that there is really no physical issues, taking care of any type of screening exams like pap smears, which are, life-saving screening exams. And in some individuals, especially if they've delayed getting care, and we really just don't have the time to take the process of doing staged exams and desensitization, that sometimes it really makes the best medical sense to do an exam under anesthesia for them.
Yeah, and I think really the real take-home message from this is that there's always going to be a solution. I think a lot of women in this situation, especially if they've had many, many bad experiences, they catastrophize and they say, I'm never going to be able to have a gynecologic exam. I'm never going to be able to have a baby. I'm never, fill in the blank. And I think our message is, no, we will find a way. We will find a way around this. It might take time. It might take, some being imaginative and creative, but we will find a way to make it work for you.
Absolutely. And also, I think so many women self-blame in that situation. They've really been trained that it's a problem with me. There's something wrong with me. And I'm really proud of the work I do here. I'm proud of the success we have. I've been able to have success in patients that have never been able to have a gynecology exam before get through it. So, I don't give up, but I'm always with
I know you don't.
the end. So.
No, I know you don't. There's a question that came in about childhood abuse and trauma. And can you speak to that a little bit about where that comes into the whole picture of requiring trauma-informed care?
Right. Well, absolutely. I mean, again, that there's so many different sources of trauma, but that's a huge one. And we know from the adverse childhood experiences data how prevalent childhood adversities, including physical and emotional abuse and neglect, are. And that, sets the stage when children are wired in a way to, be threatened repeatedly. It can cause, I think many of us have heard of that term toxic stress. Well, when that happens at a young age, that really can cause some, changes to the body that are not healthy, and it can set the stage for other medical problems in life, and certainly psychological problems. Substance abuse issues are higher in that situation too. So very challenging. But of course, if there's been sexual trauma, it's the same thing we're talking about here, that those exams can be so triggering. They can be very reenacting. So we have to be very attentive in our physical exam in the way that it's performed to not reenact any violence for that person. Physical assaults, there are also exam skills that can be learned for doing a general medical exam. And so part of my role here at Northwestern is training other physicians in other fields and how trauma can impact the care they're giving with the type of exams they do and with the type of conditions and problems that they're working with.
Yeah. So from a practical point of view, I asked you about the woman who's in the midst of an exam and is saying, no, I don't feel safe. I need you to stop. This isn't good. But in terms of being proactive, let's say there is a woman who does not have access to a trauma-informed physician. She knows she doesn't have access. She's going to see the local gynecologist. It's the only person in town. How can she advocate for herself before the exam even starts? How does a woman express to someone who isn't trauma informed, this is what I need?
Right. And ideally, that's where it starts, is before the exam, because it is, harder to extricate if you're in the middle of an exam and somebody's not trauma informed. And that's a really unfortunate situation. One option is setting up not necessarily a visit that's going to be exam focused, but kind of like you're meeting the doctor and interviewing them and making a game plan. I mentioned I often do walkthroughs with my patients. So somebody that I know has this background that they've opened us up to us and shared that, I ask them, would it be helpful for you to meet me ahead of time? No pressure. And actually virtual medicine is really great for this too, because there's not even pressure to walk into the office at that point. And let's talk about, what you're comfortable sharing with me, what is a trigger for you, what your experiences have been in the past, whatever you're comfortable sharing, and what can we prepare for and do upfront to make this as easy a process as possible for you. And then again, sometimes it becomes, staged visits for people that are seriously traumatized. There can be an initial virtual or in-person visit, walk through the exam, and then each exam is another step in the process to getting them more comfortable in the progress of a gynecologic exam.
So I have a question, because one of the things about feeling safe is being in control, right?
Right.
And so we routinely use a mirror for the woman to hold so that she can see her vulva as we are doing an exam, so we can explain what we're doing and what we're seeing. Do you find that for a patient with a history of trauma, is this a good thing, or is this not necessarily a good thing? Does it make her feel more in control or less in control?
Yeah, well, again, it's an option, right? It's always about the control. Is you get to choose if you feel like that would be helpful for you. And I would say it's 50-50. Some women say, oh no, I just need to focus on my breathing and some of my grounding techniques, and I won't be good if I'm distracted and looking at what you're doing, just talk me through it. And some women find that incredibly helpful because it reinforces, as I'm telling them, they're safe, everything's going well, what you're feeling is expected and normal at this point. And they're seeing it. So it's reinforcing, I'm not being hurt. Nothing bad is happening down there. It's exactly what we talked about was going to happen. And so it goes both ways. And it's really about patient choice.
I had a patient years ago, I've never asked you about this. I had a patient many years ago who had a history of trauma, and she told me that what got through her personally through an exam was if she had her own hand on her vulva all the time, that this made her feel protected. And I'm wondering if that was just, her thing, or is that something that you've come across?
I have definitely had patients that felt more comfortable with even inserting the speculum on their own, or different physical things. So I just guide, but they're actually doing, the insertion of the speculum, or they're the ones that are separating so that there's visibility for me to do the exam, but they're doing the actual physical contact with their own hands. So I think that's why having those conversations up front is very empowering, because then there is that sense of control. You've kind of directed what happens, and it may not always, be necessarily mean a completion of an exam, but at least for that step, it reinforces that I got to choose how this proceeded, and it went well, and hopefully no pain involved.
Right. But as we know, a lot of times it's not the pain that someone's having, it's the not feeling safe, it's the not feeling in control. One of the things I'd kind of like you to run through is some resources for women who are watching for themselves or for someone in their lives. A lot of times I think a lot of people listening, this isn't really about them. It might be for someone that they know. So could you kind of run through these quickly so that people are familiar with?
Absolutely. So of course, the National Domestic Violence Hotline is available, and they link into, the different state-based hotlines as well. Illinois, for those who are in our state, we have the Illinois Battered Women's. It's a little bit of an older name, now known as the Network hotline. So again, linking to different social service agencies, legal services, and medical as well. The National Human Trafficking Hotline is such a wonderful resource, even for anonymous tips to come in. So if you're concerned at all about somebody that you might know, a family member, because unfortunately it can happen in families, or even just concerns out in the community, then you can call in a tip for that. And then RAIN is a wonderful organization for sexual assault, abuse, and incest survivors.
Which RAIN is the one, of course, that I tell every single parent who's sending a kid off to college. This goes into their contact list, because if there's, that's a whole nother topic for a whole nother day. What happens on college campuses in terms of not safe activity and non-consensual sexual activity. So this has been really helpful. Thank you so much. I don't know if you have any last comments you'd like to make before we sign off. Any other words you'd like to leave everybody with?
I think, we're working on this. Trauma-informed care is such an important piece of health equity. And of course, health equity has been on everybody's radar this last year and a half with the pandemic, and seeing a lot of the underlying health inequities and tying them to prior trauma, particularly in certain communities of people in our country. And just, recognizing that most of the time when medical providers cause trauma, it's completely unintentional. It's really just that most have not been trained, and we're working very hard with the next generation. So hopefully it will become easier for all of us as patients in the future to find a trauma-informed care provider, because there'll be, more of us out there.
Thank you so much. And for everyone who's out there, you can direct message us any questions or comments, and let us know future Facebook Lives that you would be interested in. And please share this with people who you think might benefit from this, because I think this is information that we really need to get out there. So thank you so much, and good night.